Okay, welcome everyone. Welcome everyone. I want to call this meeting of Community Development Committee to order. Kelly, have you had an opportunity to take attendance?
Yes.
Perfect. And I have a motion to approve the agenda.
I'll move to approve the agenda, Mr. Chair. Director Erickson.
Seconder?
I'll second it, Councillor Daw or Michael.
Thank you, Councillor Daw. All those in favor signify by saying aye.
Aye.
Aye. Opposed? Agenda approved. I'll ask at this time if there's any conflict of interest to declare. Any conflict of interest to declare? There's no conflict of interest to declare. We'll move on. We have a very full agenda today. I will remind all of our speakers that we really need to adhere to their 15-minute time allotment today so that we can stay on track. At this time, I'll call Lise. Lise, you have the floor.
Thank you, Mr. Chair. I guess the first thing that I'm going to talk about today is ESIC and OPT4. So as you know, I am one of the SIN coordinators, so the Community Inclusion Network coordinators. We're all over the province, and I'm the one for the Capital Region. So when we met as a group the last time, we went over OPT4 and what responsibilities would fall on the SIN coordinators. And so they basically came up with 6 areas, and this is following all the consultations that took place all over the province. And they basically summarized all the themes. And they found some things would be done by the Minister of Health and some would be done by the Minister of Social Development. But for the SIN coordinators, they asked us to focus on 6 areas. And these areas are increasing food security for New Brunswickers, increasing access to affordable and available transportation, increase access to federal and provincial benefits that will enhance income security for New Brunswickers, raise awareness of programs and benefits. The 4th one is improve financial literacy. The 5th one is support nonprofit and social enterprise at the regional level. And the 6th one is to coordinate training opportunities that reduce the risk of stigmatizing or further traumatizing individuals. So when we start developing our regional plans for each of the province's regions, these are the areas of focus that I'll be working on along with our group. And really, the group more or less exists. You know, usually you're asked to form a committee and to start working on your regional plan. And in the next meeting of the SIN coordinators with ESIC, we'll be given the template that they'd like us to use, and then we'll be given instructions on how to proceed because there are a few of us that are new. Really, part of my committee, I would say, is already there in our resiliency group. So we've already got people from various backgrounds, and we've got the nonprofits at the table. We have our Horizon community developers, our resiliency people, and it's growing all the time. So I'm very lucky that way that our network already exists. So that is what is coming, and I'll be updating you on that. I wanted to kind of go back now and give you an update on the 3 community action grants, the ESIC community grants. So as you know, we get $50,000 for community action grants every year. So the ones that were approved last year and are happening now, we're just in the process of starting those. There was the one with, and I think Carrie might be talking because there's overlap, of course, in some of the funding between ESIC and resiliency. But one project is the Come Over program, capacity building options for mental health services for folks over 60. That was one of the things that we funded. School district ASDW, I never know if I'm saying it backwards, in food structure, support school food programs, equipment and work of school food champions. The third one is, again, ASD West to install play boxes in 8 to 10 public spaces. So those are the things that we've already received, or I believe we've received the money from ESIC into the commission. And we are now going to give part of that funding to start the programming. And then once the programs end, we'll give, and we receive our reports and we find out how it went, then we give the last chunk of the money. So we're just in the process of sending the first amount of money to these organizers. So that's how it's going with the community action grants right now. The other thing I'd like to give an update on is the commission's projects. So our 8 projects that were approved by this committee, of course. The first one was hosting a Tamarack Institute in-person training for nonprofits. So Carrie and I have already met with Tamarack and we received the estimate for the cost of this. And this session will be held in May, and it'll be part of our strategic planning process with our Resiliency Network executive. We'll also be inviting members of the municipalities to join us if they would like to. And again, you'll be receiving more information about this. The plan date is May 13th. The second project is hosting a workshop on social connectors with researcher Lynn Ouellet. Lynn has joined us today and she'll be giving us a short update a little bit later. But we did have a first presentation, I guess our pilot presentation was February 20th at one of our resiliency meetings. And so basically Lynn has been provided some feedback and her presentation has been tweaked, and we had planned a second one for the municipalities April 2nd. However, we didn't get enough interest in that. So maybe we can talk about that during Lynn's presentation, because there are further presentations that are being planned for various groups. The third project is convening leading members of communities living with disabilities. This is planned for our September Resiliency Network meeting in Oromocto. So the kinds of groups that we would like to have there, some of them already sit at our table, but others will be added. And this will be Jobs Unlimited, Minlax, L'Arche, Ability NB. So this is in an effort to raise awareness of the programs that already exist in our region, and also to align our efforts to see if we can help each other out. Project number 4 is enhancing partnerships with faith-based organization. That is also well on its way. So every time we go into a different community with a resiliency group, we've been sending letters of invitation to various churches. And so far we've had some people show up. We've had from 2 different churches. We've invited the churches in the Sunbury York area, Hanwell area, and the Nakawik area for this one coming up. At our last meeting, resiliency meeting at the grant writing workshop, there were a table of faith-based people, and we had a great discussion with them. They do outreach like nobody else. And so it's really nice to have them at the table and to have their point of view. So that is growing, and we feel that we've got some good progress there. The 5th one is hosting a grant writing course for nonprofits and financial sustainability best practices for not-for-profits and charities in today's world. That was held at our last resiliency meeting, March 20th. It was a great success. At least 30 people were there, and I think another between 10 and 20 online. Very well received, excellent presenters. We had new people that had never attended before, and we were happy to see it. And what we plan on doing is a follow-up in 6 months and asking those folks, you know, was this of benefit to you? We want to do a follow-up to see if this is something that we should do again. Did it change their so we plan on doing a follow-up email to them in 6 months. Project number 6 is undertaking a regional transportation study. Of course, our executive director, Brett McCrae, is responsible for this very important file, the transportation file. So there is an ongoing transportation study. And also an important promotion campaign for urban rural rides has begun. And you've probably seen some of those ads and Google and places like that to try to recruit some drivers. Project number 7 is raising awareness for Connect Fredericton. The status of that one is uncertain. We're hoping that United Way, the new executive director, Ben Harrison, will want to take this on and continue with this. We're not going to own this. We're going to support and promote it should they decide to pick it up. Number 8 is the coordination of 5 events promoting collaboration and asset sharing. So again, this will be as needed. We have some ideas for focus group meetings that we'd like to have. For example, the 2-on-1 list of unmet needs gives us a great idea of the things that we're lacking in our region. So we may look at that. That's something we're going to look at strategically in our resilience meeting in May, but also things like food insecurity, newcomers. So this will be planned a little later, probably in May or after May. Does anybody have any questions? That is the end of my presentation on the 8 projects.
Director Erickson does.
Thank you, Elise. Director Erickson, you had a question?
I do. Thank you, Mr. Chair, and thank you, Elise, for the presentation. With respect to OPT4, it was my understanding that the Capital Regional Service Commission needs to, through its governance structure, choose 6 of the 16 Overcoming Poverty Together 4 priority actions in order to then get them approved by our board of directors and then start actioning them. From your presentation, it sounds like those have already been chosen. So where am I in the process? Because I'm referencing a meeting Thursday with, excuse me, Stéphane Leclerc and Helene Hebert. So I thought my information was pretty good. So where am I?
Yeah, and when I noticed that nuance when you presented to the GFSI meeting, and I wondered if I understood you correctly. My understanding as a SIN coordinator is that there were 16 initiatives.
Yep.
Some were to be done by the SIN coordinators. They had already been selected. Now I can certainly obtain confirmation of that for you and from Elaine if you'd like. She's the one who supervises my work at that level. But there are 16 initiatives. 6 of them were selected for the SIN coordinators to work on. Then there's a series of 3 popables, which is if we happen to be able to advance this file through our work to do those, for example, childcare and day camps. And then the rest are all things that are to be done or initiated by various government departments. If you'd like, I can certainly send this to the committee. But my understanding is that, yes, that was already pre-selected for the regions because of these were the priority items that the SINs could work on with the community. So I would be working with the city of Fredericton, with the resiliency folks, with the people from our region to support those 6 initiatives.
Well, thank you for that. That's all very clear. What still remains unclear is why I spent an hour with Mr. Leclerc and Mrs. Hebert and the mayor working out what the 6 we'd support as the city of Fredericton are.
I wasn't part of that meeting, so I didn't know that you actually talked about selecting initiatives. I thought it was just an overall meet and greet that you had had.
No, it was 100% about, well, I don't know about what got put into the meeting booking with those 2 individuals, but I mean, that was the pith and substance of the meeting. Was to figure out what the city of Fredericton would be willing to support moving forward. And now I guess I need much more specific information about what's actually been chosen on our behalf so we can figure out how to line up city staff and resources to best support those kind of efforts.
If I might, Mr. Chair, our
Please.
understanding, which we received from ESIC, was that ESIC itself would be choosing 6 priority items from the province-wide consultation that were to be addressed by the community inclusion networks. And so we're operating under that assumption, and as Lise said, she will confirm that. We're not party to the discussion or philosophy that you had with ESIC. But while we're confirming our side, we'll also put the question as sort of, there's some confusion at our committee and at our board, and we'll ask them to clarify that for us.
Thank you, Don. Any other questions? There's no other questions or discussion. Thank you again, Lise. We appreciate your presentation. We'll move on to Carrie Bedford. Regional Resiliency Action Plan update.
Great, thank you, Director Hayward. So I included in our meeting package today the overview of our Regional Resiliency Action Plan for 2025. We are well on our way with some projects carried over from 2024, but also just getting our funding out, and most of our work is happening in the spring, summer, and into fall. So I'll just briefly touch on a few of the activities that have happened since our last meeting. Down at the bottom, you'll see the priority area of infrastructures promoting wellness. These are coming down the pipes as we speak. So at the bottom, we have the Youth Engagement Summits. Marcy Malloy and her team at Cambridge Mountains Community School, in partnership with some other Grand Lake schools, used a model that they borrowed from NACWIC in the previous year and brought it forward to other areas in the region. They successfully hosted a wonderful day. Many partners were there to help support students coming together through youth-led leadership. We heard from their keynote speaker, Ian Tyson, around resiliency and building that resiliency in your own personal mindset and how you kind of take on the rest of your day and your experience through hardships. They worked on plans on how they were going to bring that back into their school system, and just overall, how do we help to increase inclusion, belonging in our schools, but also with the undernote of reducing risk of alcohol, drug use through student wellness surveys. So that was a really fun day that we'll hopefully be able to kind of earmark for upcoming years. Coming up next, April 17th is our Health Promoting Schools project. And so that'll be bringing educators around to look at the framework around building health promoting schools in our school system. So we have our public health partners leading that, and our Healthy Learners team helping to bring those educators together to talk about the framework of what's included. So they've got a full day of learning on April 17th. When it comes to household access to food, we have an upcoming meeting on this Friday following our collective that happened earlier in the fall in October. So we'll be starting the first steps with what that looks like on creating our food security network. Under community capacity for priorities, you'll see many things on the go there. I would say the highlight today would be our Community Connectors program in partnership with R8 initiatives being led by this table, but also in partnership with Lynn, who's on the call today. We, like Lise had mentioned, we did a great event in February, and a lot of great learning and an activity that we did together to build healthy, safe communities. The other one that's in fruition right now is talking about expansion of our gathering spaces. So our senior program there, we've learned lots of great things from Gail and her team at the senior gathering place in NACWIC. And Cheryl Heaven is on the call as well in Horizon Hat, helping to lead what that looks like in starting a Horizon or a program in Harvey. So we're looking at what locations and engaging some seniors in that community. In terms of priorities for communication, we continue to offer our Resiliency Learning Network function at each meeting every month. So we've learned from Nursing Home Without Walls, we've learned about Buoyant Alert. We've had our expansion of the Community Connectors program, as well as our grant writing workshop. Upcoming meeting in April, we'll be doing a tour of the gathering space, but also hearing about what Western Valley is doing to help with their homeless. So just kind of learning from other regions when we can. Access to wellness programs. We have 2 individuals that have successfully been trained in the rural areas in Safe Talk. And so one of our participants were able to support at the Youth Engagement Summit that I referenced earlier. And the Fredericton Suicide Prevention Committee is under works in building up a small grant program to help those programs be delivered. So that's another activity that's well underway. And finally, access to services. You'll see some alignment here as well. So with mental health services for older adults, the Come Over program that Lise had referenced, $8,000 is supported by ESIC and $2,000 was supported by Resiliency, giving them a $10,000 project to work on building those connections for seniors in the Fredericton area in a partnership with the University of New Brunswick. And finally, the supporting people with living with a disability, that activity is started. Part of that project will be in partnership with New Brunswick Fetal Alcohol Spectrum Disorder Center of Excellence, looking at how do we support those with autism through things like pet therapy and whatnot. And the other part of that will be helping with diagnosis for those that are living with some form of, I'll say mental disability, and working with UNB on assessment criteria. So I would say they're gearing up, and we're really happy to have the partners we have engaged at the table so far. You'll also reference on the back here too, in terms of our funding. This is something our provincial team releases. I think it's just the next page, Kelly. Releases quarterly to show you kind of where the funds are at. Right now, it looks like we have 8 initiatives not started, but that is just simply because we haven't initiated the checks yet. And some of the projects are underway in terms of planning, but we'll get their funding once they need it. You'll also note that I like to point out here, a lot of the projects that are underway are due to a lot of the in-kind support that we see from our partners. So for $50,000 every year, for this year in 2025, we had an additional $202,000 of in-kind support. So that could be waiving the rental fee, offering services in kind, those professional pieces. So I think that helps to build the strength of what we're trying to do with our social infrastructure here at the Resilience Network. Open to any questions.
Thank you very much, Gary. Are there any questions from anyone in the group? One comment I would like to make is that's a very significant number, 202,000 of in-kind.
Yeah.
That's impressive.
It's fantastic. And
Very significant when the base is 50,000.
Exactly. And I encourage anybody to join us in our meetings too. We meet the third Thursday of every month. April 17th is our next meeting in Nakawik. Gail Farnsworth is hosting us at the Nakawik Lions Club. She's feeding us and everything. We didn't have to work after any of it. So a lot of in-kind generation there too.
Good to hear.
Mm-hmm.
I'll ask again, are there any questions for Carrie before we move on? Thank you very much. We'll move on to Lynn Roulette, Social Connectors Program.
Hello, thank you everybody for allowing me this opportunity to speak about the work that is very well supported by all of you. Let me share my screen. Oh. Anybody see my slides? Mm-hmm. Wonderful. So as anybody knows, I'm very passionate about all of this, so I could speak forever. I do want to respect this time. So my name is Lynn Modet. I am a PhD candidate. I look at staying connected within the community. I was part of a pilot where we worked very closely with the Age-Friendly Committee in Fredericton, looking to spread the word about existing community resources, one conversation at a time. So to let you know kind of where we are now, I'll let you know how this all started. This started before I came on board. The Age-Friendly Committee brought together, I think, about 50 organizations in the fall of 2019. I'll note pre-COVID time. And they wanted to know, how does everybody stay connected? How do people find out about things? So my supervisor, Dr. Banerjee, was in the room. He devised a study where we just talk to people, find out about things, as well as look at promising practices locally, nationally, and internationally. So that's when I came on board, and I've been along for the ride ever since. While we were talking to people about how to stay connected, also looking at practices, and we identified a practice in Frome in the UK as something that maybe we could pursue. So we got some funding from the Healthy Seniors Pilot Project, and we trained some Meals on Wheels volunteers to be our community connectors. We identified an information access point. We were lucky that just as we were rolling all of this out, 211 became a part of our New Brunswick ecosystem. And then in the fall of 2023, we hosted yet another town hall brought together some of those people who were originally at the first town hall and then some new people, let them know what we've been doing as well as identify ways forward. So I'll go over all of these little parts to let you know. Oh no, it won't let me fast forward my slides. I may have to do it this way. So in that first study, we wanted to know, how do people access community sports? We also wanted to know, is the programming that's out there relevant? That first town hall, a lot of people kind of came to a consensus. They're like, we keep seeing the same people over and over again. We know there's people that we're not reaching. What is it that we need to do? So we heard from the people that we spoke to, lots of barriers, things that I think we all know around the table here. Things are expensive, transportation is difficult, certainly health impacts things, but how do people find out about things? They can't go if they don't know. So that's what this project is about, is trying to let people know about the activity so that they can actually go. Let me see if I can actually do this now. Here we go. So Frome is a community in the UK. It's a population of about 30,000, so comparable-ish to what we have here. And they've been able to have a community connector strategy running since about 2013. They started off very small, but they've been able to have lots of successes along the way. They have a peer-reviewed article that shows they've reduced hospital admissions significantly. I believe it's about 14% for the duration of the study, as well as their comparator community actually increased by, I think it was 28.5% in the same time period. So we could almost say they saved, if you will, hospital admissions of about 32%. They've been since named as a community that is desirable to live in. They had a lot of outward migration, something that I think we can identify with here. And all of a sudden they became a place where people want to be. And the population is actually increasing of all ages. They've been
And I don't
featured.
to interrupt, but we can't see your slides.
Oh no. I'm having such technical difficulties. It never usually works this way.
I can see them fine. They just needed to be advanced.
Okay, well, I'm gonna have to just go through this then, I think. For some reason, it's not working for me today. Where was I? Anyway, so Frome has been featured in the BBC, in the New York Times, all sorts of places. They have, if you can see over here, developed a toolkit that was released in the spring of 2024, I want to say, at the National Academy of Social Prescribing. And I'm very fortunate to have been a part of developing this toolkit. Basically, this is all about trying to connect individuals to things that are existing. So it's not about more services or offerings as much as it is a way for everyone feeling they are a part of the offering. A meal, a ride, a bit of compassion, and help piecing life together when everything falls apart. It's giving people the services they need, but also building the resilience they have. So in my academic work, I do look at what are community connectors. And there's all sorts of community connectors. They have all sorts of names and they have different roles, et cetera, et cetera. But a community connector can be something as simple as a neighbor checking in on a neighbor. Now, this type of community connector is relatively simple. It's as simple as you're at a bus stop, you get in a conversation with Mrs. Smith, and Mrs. Smith says, I'm on my way to the hospital to see my husband. He's had A. And it could be anything. It could be he's had a stroke. He has had a heart attack. He has diabetes and there are complications. He has dementia, and on and on. It could be any number of things. You, as a community connector, realize, wait a minute, Mrs. Smith might be able to benefit from some community supports that exist out there, but I don't know which ones specifically. So these community connectors don't pass on information about specific services. There's no way you can know everything about stroke and diabetes and dementia and all this sort of stuff, but they do pass on information about information access points. So our information access point was 211. Now, it's important to note that this type of counselor or community connector is not a counselor, They do not provide advice, they do not exchange information, and they don't do follow-up. In fact, this interaction here could end when the bus comes and one of you gets on the bus, and you may never know what happened to Mrs. Smith after that. That's where we're a little bit lucky. We've stayed in contact with Froome throughout this. In fact, they just emailed me a little before Christmas. I told them about some upcoming projects we have, as well as they're telling me some things that they're doing. And in Froome, that conversation, that kind of one-off interaction, they've been having a hard time capturing, if you will, what happens in that conversation. It's hard to chat with, if you will, the recipient of the conversation. Because we trained Meals on Wheels volunteers, we were able to then follow up with people who talk to a community connector and start teasing out some of those things that are good and bad in the conversation. But in speaking with Jenny, the lead in Froome, what she does say that's important in that conversation is that they find out their community is there to support them. When people are going through things, they don't necessarily think of or are aware that there are things happening in their community that could help them out. So I want to take a moment in this presentation and ask you all, as I'm going through this, do you have anybody in mind about who might be a, quote, good recipient of this conversation? Do you have anybody in mind who might be a, quote, good community connector? Is it a type of situation you might find yourself in, or this person may find themselves in? Are you picturing someone in general? The reason I want to kind of take this moment and look back on what it is that the image that you're kind of in your head is usually when I talk about this, and what I didn't say that I study a lot about. I do study about connection, but I also heavily look at isolation and loneliness. And what's interesting is as soon as you enter those words into the conversation, different things kind of come up into people's heads. So that first town hall was not only about connection, but it was about addressing loneliness and isolation. And in fact, Froome keeps being highlighted as a place that has found the cure for loneliness and is fighting isolation. And those words bring up images in people's heads. I know I don't have a lot of time. If we have 4 minutes, I'd love to show this video. I think it very succinctly tells of the program and the successes in Froome that I won't play it now. But basically, isolation and loneliness is something that affects everybody. It has a huge impact on so many domains of our lives. It's been shown to increase our risk of cardiovascular disease, of dementia, of youth. There are higher levels of attrition in university. They have higher dropout rates in high school. There is increased loss of income from workplace loneliness, low productivity, staff missing days of work because of loneliness and isolation. But by far the most often quoted research that when I kind of look at all of this is this study that shows the influence of our social relationships on the risk of dying is higher than the things we already know about. So those two top bars on this graph are related to our social relationships. So things like isolation, loneliness, lack of connection, and our risk of dying, if they are poor, are higher than if we smoke 15 cigarettes a day, than if we drink alcohol excessively, than if we have poor exercise, and on and on. These are things that we know we need to address as individuals and a society, but relatively speaking, the attention that isolation and loneliness has is still not quite as high as these other risk factors. So our project was starting off from the point of addressing isolation, loneliness, promoting connection among older adults. We trained our volunteers to speak to people on their routes and kind of have their antenna up, and should the need come up, to say, hey, why don't you try calling 211? What we told them as well, though, is we didn't restrict it to just people on their routes. I mean, it's just telling people about 211. And so we found out a ton of stuff Indeed, they told a whole bunch of people. They told nurses, they told teachers, they told people they play bridge with, they told all sorts of individuals. They let people know, family in Alberta, for instance, have you thought about calling 211? On and on and on. So this is really about word of mouth and spreading the word to anyone. It's creating a network of information for anybody who would benefit from community activities, health support, or any other service that's in the community. The other thing we also found out is this was about connection. Again, we told them, let people know about how to find out information, but over and over, our volunteers said that they actually created some great relationships with people. In the words of Frances, she says, it gave me a beautiful opportunity to really meet my clients. So I would think the program was more beneficial to me and my clients than the actual information that we were trying to deliver. We heard from our volunteers that it created awareness, that a lot of them said, it never occurred to me to listen to issues people may be having. And I actually, on reflection and in speaking with the team, it's not necessarily that they weren't aware. These people, to sign up for a university, led study, and you got to sign all sorts of papers and all this sort of stuff, it's a bit intimidating. So these people are already kind of doing a lot of great stuff for the community. They know a ton of stuff. And it wasn't that they weren't paying attention, but we also heard the word confidence over and over. All of a sudden, they heard things, and then they had something that they could help them out with. We heard that card was a great icebreaker. Hey, have you heard of 211? This is what this is. And quite frankly, 211 is for a wide range of people, resources, etc. It's non-judgmental. It's for anybody who might need help at any point for any sort of topic. Now, as for the older adults that we spoke with, we did speak to some who spoke to community connectors, and we spoke to some who did not. So for those who did speak to a community connector, all of them, I would say most of them, knew about 211. Not all had called. They didn't really have a reason to call, but they all knew about it. And what was interesting is as I was asking them about 211, they were like, wait a minute, is this card that this person gave me? Those who did not speak to a community connector did not know about 211. And what's interesting about that is Meals on Wheels regularly puts 211 information in their newsletter. They've put cards in with the meals to be handed out. So people have received these cards, but they don't know what 211 is. And I think that's a little bit about how we pay attention to information. We get sources of information from all over the place, and we don't pay attention to something until someone brings attention to it. So what's next? I've got a ton on my plate, which I'm very excited about. I'm learning about where community connectors exist in the ecosystem, what they do, their roles are. I'm actually currently writing up my PhD proposal. I believe my research question is going to be how municipalities can act as community connectors. I plan on doing a policy scan of municipalities across the country in terms of what they have in place. I also am going to be doing interviews with different municipalities. I've started this process a bit. I've reached out to some communities that are incorporating connection work within their city mandates. The work they are doing is amazing, and I can't wait to kind of dive into that a little bit more. But what I'm really excited about here locally, with the support of the Resiliency Committee, Capital Region Service Commission, I'm going to be doing a roadshow. And so I want to find out not only and kind of provide people, kind of have your antenna up, let people know about resources. I want to know what is a connected community to you. So we do have different groups lined up. I'm still sorting out some more workshops. And in those events, we have tables set up and people create what they envision as a connected community. I hope to use this in terms of future planning, helping us identify things that people see as important. We did do our first one in the resiliency meeting, February 20th, I believe it was. And already within there were some great ideas, but I think one of the things that I got from the communities that were created is creating spaces and activities where all sorts of people can interact and we can learn from each other, we can help people feel included, but that we also address some barriers that keep people from attending different activities. And so, excuse me, on that note, I thank you very much for your continued support. These are my two helpers. They're with me every day. They're with me right now, in fact. And I look forward to any questions and letting you know as things unfold. Thanks.
Thank you very much, Lynn. Any questions on any of Lynn's presentation from anyone in the group? We do have a little bit of time if you did want to play that 4-minute video. If there's no
Yay!
objections from anyone in the group, I would be curious to see that.
Okay. Now, you saw me. For some reason, my technology, you have no idea what kind of day I'm having. Anyway, hopefully this will work. Can you see the screen?
Yep.
Okay, here we go. Let's see. Can you hear the sound? Yay! Okay.
It stopped.
Yeah, it stopped. See, I'm telling you.
Uh-oh.
In this world.
Are we back on track?
Yeah.
If you become disconnected and feel lonely and isolated, it's very difficult to look after yourself as well.
When you get older, your whole life changes. Your children have grown up and gone, and I can't expect any person to keep coming here when they've got their own lives to be leading. I don't think anybody can explain what the loneliness is like. I was in a terrible state. I knew that if I didn't get somebody here to see me, that I would die.
So it's treating them with kindness and compassion and listening to their story and understanding where they are in their life and what needs to happen next to make that better. Right, how are you?
Very well.
Yeah. You were saying that you felt quite isolated?
Yes, I did. But coming to the club, we got into a little circle of friends and we all got to know each other and it was nice seeing each other.
We always give them, I always carry some brochures with me and I can give them the brochures. And when they get a hold of the health centre, the Health Connecting, then they're able to point them in the right direction.
We can just help people to get in touch with the support that's out there. There is so much support. And just to help people not feel sort of isolated, really.
We've got that 500 people who on average will talk to 20 people a year. That's 10,000 people put in touch with those resources.
They phoned up one day and they said they got this male that would come to see me, and that was the best thing that ever happened. And I can't I can't tell people what a difference he's made coming.
For every £1 that's spent on this scheme, the NHS is saving £6. And the joy of this project is that you see the huge impact it can have on individuals turning their lives around, being given back a sense of being part of a community again.
See, I always contemplate, I'm like, my presentation should just be that video. But anyway, thank you for letting me play it.
Thank you very much, Lynn. On that note, are there any other questions from the group or discussion around Lynn's presentation? There's nothing further. We'll move to the last item on the agenda. The statistics on the capital region. Louise Lockhart.
Hi, everybody. My name is Louise Lockhart. I don't have a presentation to put up necessarily. I'm a senior program advisor, so I work for public health in the region and for all of Region 3. And it's my job to really get a sense or to keep an eye on some of the public health needs of the different areas, and they are quite diverse. Their populations are diverse, like Minto Chipman has the oldest average age, and so they've got perhaps more pronounced needs in certain areas. And I just want to mention that our office, because we're meant to support all of the regions, I'm always happy to do a bit of digging, and through the Resiliency Committee, it's been fun to look at some of their specific entities like Hanwell or Entity 63, and then really pull out some data that's very specific to the region. So not just something like population level, but median incomes of the single parent households, which is often a stark difference. Number of people living alone, seniors, how many people are commuting over an hour from that community, and are they going as a passenger or a driver? Number of youth under the age of 18, number of infants. So you get a sense of kind of the needs that a community might want to pull together to support. And also language, and then obviously renting and owning and core housing needs and things like that. And so if I didn't pull that up for every community that I for today. However, we are happy to just give into a little bit more time. And I really do pour over as much data about the communities as I possibly can. And one piece of information that does stand out to me is the number of people who move to our different communities. So for example, let's just take Hanwell as an example. Can I get you guys to guess how many, every 5 years, one in how many households is has totally been turned over from someone who didn't live in that neighborhood or in that census area at all, like in Hanwell? Do you think it's like 1 in 20 is a new person, is a new house, 1 in 10?
1 in 5.
Very close. It's 1 in 4 for Hanwell in particular.
Wow.
It's 1 in 3 for Fredericton, a bit more than 1 in 3 for like Roshagonish, Wasis area. So, and that's every 5 years. So the turnover. So every 5 years, between 1 in 4 and 1 in 3 people is brand new to the area, to the neighborhood, to the street, to the census area, actually. And the far majority of them are actually just from another place in New Brunswick. The next largest group is from out of province, and the third largest group is international. So when we think of, I know I'm just reading about your guys' role of really helping newcomers, but newcomers isn't just international people. It's like, I'm just new to the neighborhood. I don't have a social connections. I don't have friends. I don't have a social capital or network, so that if there's a major storm, I'm actually going to have to lean on official services instead of my neighbors. So I've always, that's one stat that has really stood out to me, that's maybe under recognized by many almost municipalities and stuff, that we need to continually making an effort to bring people into the larger community, but also encourage the kind of first contact with neighbors somehow, whether it's making welcome wagon tools, trying to look at your community from this perspective of someone who just arrived, because every single person wins, because they become more resilient and they also become more helpful. They're volunteer assets. They have ideas and experiences from other places. Generally, our demographics are leading towards increasingly single people with or without children, increasingly childless people, in general and elderly. And all three of those demographics, in particularly need, connection to be, to do well. Which leads me to my second, just small point I wanted to mention. In terms of future data that we're thinking about all the time. I just wanted to point out this one piece of the aging demographic that's coming. It's not something we see it's something we see slightly in our current demographic, but it's something we have on our mind at Public Health as like a real challenge that I try so hard to think about this now. And I'm just gonna read a tiny bit of a few extra numbers just to give you some more sense of what I'm thinking. So between 2023 and 2048, under a medium growth scenario, the proportion of people aged 65 and older in New Brunswick will increase from 23 to 26. The number of people 85 and older will triple from 2.4% of our population to 6% of our population. So aging, like raising the kids, takes support from the larger community and caregivers. We do not expect our government services will be able to provide all of the care that is needed, nor does it currently. It doesn't currently at all. I know a lot of times people think, oh, there's nursing homes, like there's like 75,000 seniors and there's only 8,000 nursing spots. Like it is. So we really have to remember that it's actually informal care workers that provide the largest amount of care support. They provide about $2.4 billion worth of care in New Brunswick, and 1 in 4 people currently over the age of 15 is providing care to somebody. 89% of people who do receive care actually get help from family and friends, leaving only 11% of people in our province exclusively getting care from government services. So informal caregivers are, which is family and friends, are going to be a larger and larger asset. I'm sure we're going to recognize that because they will be pushed. And I just want to mention that the strongest predictor of an interaction between kin and general in the specific context of elder care is residential proximity. If you live really close to someone, your likelihood of helping them is much bigger than if you live across the city or in another city. So the quantity of care that someone is able to give is most influenced by how closely they live together. So facilitating people to live closely together will be important. And I'd like to point out that although we always think that elderly folks are going to move towards their kids, 2/3 of what they call proximity enhancing moves is actually kids moving closer to their parents, just for the record. And also another note that we don't need to think we're not expecting family to become nurses, but the most common unmet home care need right now is actually the most common types of unmet home care needs are actually support services rather than medical. Things like housekeeping, help with meals, bathing, shopping, yard work. And so it's not that we're going to be asking people to be nurses. That is a pretty narrow skill set, specialized, but it's those other things that keep someone sustainably living a good quality of life at home. And the closer it is that they have help, whether it's family or neighbors that they know because they got looped into the community when they arrived, it's just wildly impactful on that person being able to live at home, and live at home well, not like live at home unsupported, lonely, isolated, which I 100% agree with what Lynn was talking about. Loneliness is a huge contributor to earlier hospitalization and worse outcomes in hospital, especially shockingly with heart problems. It's like the research is so clear that we do need to help. I guess people feel less isolated, to help them not have to go to the hospital either inaccessibly or prematurely, I guess. And to have someone to support them with their everyday needs, like yeah, social interaction, but also food helps them basically us preventable problems. So I just want to mention those two little pieces. Also, 1 in New Brunswick does feel isolated most of the time currently, and 1 in 5 does feel alone. And you can actually look up your community. So I just wanted to mention, can I just get you to go to a lot of this information, Stack can, but the New Brunswick Health Council is redoing its health surveys. But if you just go to data, I just want to show you where you can look up the stuff for your own communities. Go to data by community. And then scroll down and choose, actually keep going down, and then maybe choose, I don't know, Fredericton or any one of the ones that you want. Yeah, great. And then so click the double link there. And if you go into this, I mean, it's not the same overlap as the way your RSC is split up. But if you maybe go down, scroll down a little bit more, and you'll see social and economic factors. Scroll up. Actually, maybe I'll just jump on that thing for you. I can make it easier.
You're probably.
And the reason I'm just showing you this is like open data, like, and you can sometimes learn a lot from your area. Like, I love this stuff. I don't know it by heart for every community, but, and this is being updated. So under this one, for example, you can also add others to compare. So I'll just go down to some interesting things that I would pull out. You know, the number of people who have a sense of community, that's important. This is interesting, the number of people who have internet access at home, like that's like low in Shipman, even relatively low for adults. NA is often because the population is too small. Here, just a second. Stress, you'll find in communities where they have to commute a lot, the parents have time pressures, this one's not too bad. Anyways, it's a really interesting resource that you can just peruse through yourself. And our office is always happy to help interpret. A lot of times there's a data point, but it's like, yeah, but what does this mean? Like the number of single parents, what does that mean? And then we look at like the median income of single parents, and if it's low, then like single parents is the most food insecure group that there is. And so sometimes additional support needs to be made for that subgroup within our population. Anyways, our office is very, very happy to help interpret this data or put together certain summaries based on certain topics that you're thinking about. But I encourage everybody to think about seniors or aging demographic, but also connection. So income is probably the most influential social determinant of health. And then maybe next is our social connectedness, because you lean on people when you are not just struggling for money, but like it's a huge social safety net to have social connections and know people. But if you move to an area or you're in an area and you just don't know anybody, that's a little bit unideal, I guess. That we worry about the number of people who are unconnected. And yeah, so don't hesitate to reach out through Lee's and Carrie certainly know how to contact me, and we'd be more than happy to do additional digging for your communities if you ever wanted.
Thank you very much, Louise. I believe we have a couple of questions. Lynn, your hand was up first.
I will go brief, but I will just kind of reinforce those things. I think as well in terms of thinking about people moving within even our city, the housing crisis has caused especially older adults to have to move to new communities or neighborhoods. And so that leaves them disconnected. I will say in the preliminary scoping I'm doing and speaking with municipalities across the country, they actually have an eye to increasing neighborhood connections. And the theme of the different cities I've connected with so far is, which I know you all know Suzanne White, who was really into neighborhood block parties. They all actually incorporate neighborhood block parties within their programming, recognizing the value of neighborhoods. In terms of speaking about nursing homes, I think it's about 5.9% of older adults in New Brunswick go to a nursing home, but there's 599 patients within the Horizon system right now waiting to go to a nursing home. And the New Brunswick Health Council as well, if you look at our region, so Fredericton, I think, again, the region is structured differently than here, but our region is actually, according to the last 2021 report they have, our region is the loneliest by far within the province. So something that we need to think of. So thanks, Louise. Great numbers.
Thank you, Lynn. Director Erickson, you have a question as well?
I do. Thank you, Mr. Chair. I guess my question is, and Lynn, thank you. You kind of answered it with a 5.9% figure that you just threw out there. But what I'd really like to know is by housing typology, how are seniors finding shelter in our community? Because one of the things that I can't find on the StatsCan site is what happens to people after they sell private property or moved out of a shared residence into managed care. I'd love to know how many managed care beds we need for the senior population of the residents and constituents that I represent. And I'm having a really difficult time finding numbers or ranges for how to predict or incentivize that form of housing typology as a municipality in order to create those opportunities for my neighbors as they age. And don't be fooled, I'm talking about this as a policy problem, but I have a 95-year-old mother-in-law and an 85-year-old mother, and we're actively in this space looking for services and supports and all these other kind of things. And so any information you could share would be great.
That's a good point. And I'm nervous that someone would say, we're gonna need this many, and then everybody will be, well, we won't be able to do that. So, but yeah, I hear you about if you get a sense of the rate of that seniors in general need nursing home care without exception or 24-hour care. Both are very expensive. And yeah, watching the demographics is a great question, obviously.
Yeah, because I mean, I think we're about 750 short based on what's stacked up at the deck, minimally. But those are probably
Yeah.
people from outside our city, but not from outside our region. So.
Or actually I think also there are a lot of people who just, the level of service that they need in the community is not available. Like, you know what I mean? Like, I think some of them are from Fredericton. There's nobody to give them that care outside of that level of care outside the hospital. For a portion.
I'll kind of jump in terms of, so I was also looking at StatsCan information recently, looking at housing, private dwellings, etc. I think for myself, I'll say the other hat that I've worn in the past. I was a physiotherapist. I've worked in several provinces in a variety of hospital settings. It's given me an ability to kind of see how systems work, etc. And what's interesting to me, again, I think Louise and I speak the same language in terms of public health. It's all that upstream stuff that if we could just put things in the system to prevent these things down the road, my personal, as a one small item, would be we need more assistive devices in the system in New Brunswick. When I was a physiotherapist in hospital, we sometimes could not walk with a patient in the hospital because we didn't have enough walkers in the hospital, which then when they're not walking leads to a whole bunch of other, bad things, let alone we would also keep people in the hospital for longer because they did not have access to a walker when they went home. And that's one small piece of the problem of the system. We are lacking, if you will, those services and supports in the community. I think at the risk of speaking out of line, what I do find challenging is the disconnect between health and community. And I was one of those people when I worked in healthcare. I had to put out the fires, get people out of the bed because somebody else, 10 other people are waiting for that bed. Rarely was I aware of all the supports that existed in the community, and that continues today. That 211 thing I'm telling you about, I can guarantee There are many healthcare professionals who don't know about 211. My husband is one of them. He's a physician. And I've been working on this for 2 years. And we walked the dogs one night, the dogs that you saw. And I was telling him about 211. And he's like, what's 211? It's like, how is this possible? How do you not know? I've been doing this forever. He is now one of my best community connectors. And he tells people all the time about 211 on discharge planning. He's done his own little survey. Discharge planners don't know about 211. Social workers don't know about 211. Other physicians don't know about 211. We tend to think of healthcare happening in hospitals when health happens in the community. So I think that, and your question is quite a valid one, but it's a very broad, there's so many layers that impact the ability of people to remain in their homes, not just the home they have, but the supports and services that need to be there. So anyway, that's my little, on my stool here, but.
Thanks,
you,
Lynn, for that. I think that's a very helpful answer to my question in some ways, but like until the municipal sector understands as a housing typology form what we need to incentivize, we can't be self-righteous about our ability to move towards a solution to these problems, right? So we're operating in the dark, and we don't need to be. We understand what kind of housing typologies we need for a variety of other purposes, including affordable housing in general. But boy, do we ever need help with that last piece, even from a data perspective, or even from the perspective of who to put some advocacy pressure on at the provincial or federal level to change things. I've worked on all kinds of problems, in the last 13 years, and some of them start from square one, where we've got to meet with the neighborhoods and start generating support for, a long and far away policy objective. But we're not even in a position to have those conversations or take those steps yet. And I hate to see all these wonderful services happening by nonprofits, because until there's an adequate policy foundation for all of this work, all we're doing is burning up the elbow grease of the volunteer sector, and there's going to be no replication of the systems moving forward. And we need to make sure that they replicate moving forward. Anyway, I know you share these concerns. Thank you very much for your time.
Thank you, Director Erickson. Any other questions? Any other discussion? I did have a couple of questions, and many of them have been answered after I wrote them down throughout the group, including what data was available and where and how. And with regard to the aging demographic, New Brunswick is where comparably on to the rest of Canada?
We're one of
Louise?
the oldest. I think we're one of the oldest. I think us and Newfoundland, we kind of, yeah, one of the oldest.
Second oldest.
So I also just looked at all these recently in terms of projections. So not only are we one of the oldest, we are expected to be the second highest proportion growing older adult population. So Louise quoted those stats. So 2024, our numbers were, I believe, 23%, expected to grow to, I think, 26.2% by 2049. I could have those a little off. We're only second in proportion of older adults growing to Newfoundland. Newfoundland is the highest proportion expected to grow. Oddly enough, I think BC was somewhere close to that as well. But from what I understand, I mean, BC, warmer climate, if you will, et cetera, a lot of people moving out there. But definitely New Brunswick, we are headed for quite a growth in our older adult population for sure.
Dr. Hayward,
Yes.
Mr. Simpson, question.
Thank you. My head's been just spinning since Lynn started her presentation and then Louise. And I get around and see some of the problems with seniors, especially in homes, and there's so many different kinds of circumstances that prevent them from getting the help that they need. I heard Louise talk about 2 or 3 things there, and I thought, well, like single wives or single this or single that. And I thought, well, how many people are working and paying income tax to pay all these people to live. What's our financial ability going to be? And so we have a large group of people, not nearly enough to deal with all the problems that we can now identify. And science has increased to the point where there can be solutions, if the solutions can be delivered to all of these people. But I kept 3 or 4 times, I thought, you know, we just don't have enough people. And we got the wrong mix of people in our population. And so, and then I had this scary thought of, well, you know, it's families. Years ago, families looked after so many of the problems that we're talking about. And now, so you get, in couples, 2 people go out to work. And so we have latchkey kids and so on. But I thought at one point that we need a buddy system to many of these seniors who are so lonely, and I see a lot of them. I see a few every week and other things that I do. And but then I thought family. And then I had the scary thought about this project 25 in the States. And one of the things that they're trying to do is go back to family, along with a whole lot of other terrible things. But it seems if, and I wanted to ask Louise, is there a pathway for all there has to be a pathway for all this information to focus its way onto the federal government or the provincial government that will only solve this over long-term policy changes? And I mean long-term, I mean 30, 20, 30 years. And it's really frustrating.
There's a number, it's called a dependency ratio that we use in,
Yeah.
you know, and that's kind of talking a little bit about what you're talking about in terms of the number of people to support the number of people who are dependent, both children and seniors. And they require different ratios too, depending on how healthy they are and like, for example, and like in terms of like, you know, a population with high rates of dementia is gonna require a lot more help than a population that have better vascular health and have less dementia. And the pathway, that's a great question. I mean, there is a whole, in social development, there's a whole senior secretariat. I have a feeling that they would understand these projections. But whether we're being coordinated about it down to our municipal players, I don't know. It's a great question and very important. Like, I'm like, this is the problem that will peak in like 10 years, but it will take 10 years to get ready, kind of thing. And not just, and I must stress, I don't think we can jump in just with services. Some policies like encouraging people to live really closely together. Like when they say multi-generational living, like this is what they're talking about, like kids living with older people, because then they're extra set of hands and they get used to it and it becomes a bit of a cultural thing. And like honestly, even in Singapore, they pay families to move close together because like they just help with the moving costs. Like if you can move within 2 kilometers of your parents, we'll give you money. So those kinds of policy levers. Because yeah, but we cannot, we generally shouldn't just look to what services can be in place to absorb this, because it's not the most efficient. And currently services don't even come close to supporting all the people who are being supported. The far majority of people are being supported by you know, family like you're mentioning. And
I think our country did recognize that we don't need enough, that we don't have enough people. So a lot of people came in and we said, whoops, where are they gonna live?
yes.
Whoops, well, what about the teachers and the nurses and the doctors that are going to be needed? And some people didn't plan things very well.
And with our cultural things, like there are, like, we're not at a time anymore where you have borders. Like I remember my parents growing up, they always had kids who were boarding because that's how they got to school, or employees, and that our culture is not that like that anymore. Even though there are certainly enough rooms and we don't share the same, and that's is what it is, I guess, so.
So on that happy note.
Ben, thank you for your question. Lynn, you'll be the last one to have a chance to speak today.
Okay.
You had another question?
Again, I'll be very brief on the heels of that, but in my world is about loneliness, isolation, connection. And the reason I started my presentation today the way I did is usually when I ask people, what is your image of isolation and loneliness? It goes to older adults. When in fact, especially according to Stats Can, their wellness survey done quarterly, over and over and over, the loneliest portion of Canadians are individuals who are youth and young adults. And so in terms of addressing this issue, yes, absolutely need to address it for older adults, but it's, quote, not over. And in fact, if we don't address this issue through the life course, especially to youth and younger adults, when they arrive to becoming an older adult, will be experiencing even higher proportions of loneliness and isolation with all those trickle-down effects as well. So for me, I see this as a system thing that we need to make sure that we address across all ages. So I'll just say that.
Thank you, Lynn. On that note, again, I'll thank all of our presenters for their time and expertise today. I'll call for a motion to adjourn.
I'll move to adjourn, Mr. Chair. Director Erickson.
Thank you, Director Erickson. Everyone enjoy your afternoon.